So thank you so much for having me today. I appreciate being able to share what Nami, Wisconsin does. We'll just get right to it here. Let me see if I can make my slideshow work. There, whoop. Well, right? So,
it's okay.
one of the fun things about Nami is it's a national organization, and it was started right here in Wisconsin by some moms who had sons that lived with schizophrenia, and they were really annoyed that no one was paying attention to their needs, providing them services. And back in that day, most people blamed schizophrenia on mothers and not recognizing that it was a real mental illness and a real medical condition. And so these are some of the moms that lived in Madison, and they got together and had a conference here in Madison. And people from all over the country came. They were expecting just a few, and it ended up almost 300 people showed up. They started the organization here in Miami-Dade County, and then they moved and started the organization in Washington, D.C. And we first had some affiliates, and then they decided, you know what, we can't do anything if we don't have a state office. That's the way you talk to the governors and the people in the state. So that's when Nami, Wisconsin started. So we're celebrating our 41st birthday this year. Last year we celebrated 40 years. And so I always love to share that with people when I talk to them who live in Wisconsin. So as I was explaining, we're part of a 3-tier organization. So there's Nami National that's based in Arlington, Virginia, so they can access Washington, D.C. Then there's the Nami, Wisconsin, where I work. We're the state office. And then we have 27 affiliates all across the state. So this is the map of our current affiliates. So the kind of light blue is where we don't have an affiliate, and the ones that are the pretty colors are where we do have affiliates actively working throughout the state. So I'm just going to let this video, hopefully it'll work. Just this kind of gives an overview of who we are and what we do, and I'll let you guys listen. Let me know if you don't hear it.
Hi, we're Nami, Wisconsin, and we're so grateful that you are interested in learning more about our organization. Nami, Wisconsin is a state organization of the National Alliance on Mental Illness, aka NAMI. NAMI is the nation's largest mental health grassroots organization and was founded right here in the beautiful state of Wisconsin. Our mission is to improve the quality of life of people affected by mental illness and to promote recovery. 1 in 5 people live with a mental illness. That's over 1 million people in the state of Wisconsin alone. Wisconsinites who live with a mental illness could fill Lambeau Field over 14 times. These are your neighbors, coworkers, friends, and family. While this is uncomfortable to talk about, suicide is a national health crisis. Unfortunately, suicide, which can be completely prevented with proper care, is the 9th leading cause of death in the state of Wisconsin. So, what is NAMI Wisconsin doing to help people who live with a mental illness? We support our 28 affiliates located across the state. We train people to provide crucial support groups and classes in their local communities. We advocate for mental health on the state and local levels of government. We create and distribute resources for people who don't know where to turn. We host educational and awareness events such as our annual conference, Action on the Square, and the Healing Art Show. We coordinate trainings for law enforcement officers on how to improve outcomes of interactions with people who are experiencing a mental health crisis.
Hi there, I'm Maria Hansen. I was diagnosed with schizoaffective disorder and PTSD over 35 years ago. That struggle led to many years of being in and out of the hospital, in and out of psych wards, struggling with suicide attempts. Later in my life, dealing with anxiety that was often crippling and left me staying in my home instead of going outside and enjoying life. Dealing with voices. I was unable to keep a relationship. I was unable to keep any sort of personal life. And that was really destructive to me. It was hard. To this day, I still have to carry some of the scars of that life. But NAMI helped me believe in myself. helped me become empowered and recover. Nami has been a core part of my story in mental health and a core part of my story of advocating for people with mental health issues.
Please consider bringing hope to those in Wisconsin who are affected by mental illness. Donate or become a NAMI Wisconsin member today. Thank you so much for taking the time to learn about our organization. For more information, visit namiwisconsin.org.
Let's see if we can go to no, there we go. So that was kind of an overview of who we are and why mental illness and why we have so much focus on this is because mental illness is pretty common, as we mentioned in that video. 1 in 5 people live with a mental illness, and 1 in 25 live with a serious mental illness. And we define serious mental illness are those that are diagnosed with bipolar disorder or schizophrenia or schizoaffective disorder. And so those people have an illness that usually can create a inability to function well in the community without the help and support of providers and the community. So 859,000 adults in Wisconsin have a mental health condition, and receiving care earlier greatly increases the odds of a positive recovery and reduce the most significant side effect of mental illness, which is suicide. And as we just stated, suicide is the 9th leading cause of death in Wisconsin, but the 2nd leading cause of death for those ages 14 to 24. And some of the challenges we find with getting help and getting care is the discrimination and stigma of mental illness delays people getting care. There's a lack of mental health workforce, and that delays people getting care. There's a lack of crisis stabilization centers throughout the state, and that delays people getting the care they need. There's been a change in how people respond to people with mental illness. Back in the 70s and 80s, there were a lot of psychiatric hospitals which were run really poorly and didn't do a very good job. And they closed a lot of those mental health hospitals. And unfortunately, they didn't follow up with any funding for community services. So then it's ended up that a lot of the people that were having crises, the response was people would call the police and the police would respond. And we're calling this the criminalization of mental illness. And so we're seeing that now. We're seeing a correlation of the number of psychiatric beds that have decreased and the increase of people that are in jail that are diagnosed with mental illness. It's very correlative, and we're trying to figure out better ways to change that system. And the current laws, quite frankly, delay people getting care. Unfortunately, when someone is in a mental health crisis, they may not understand that they're in a mental health crisis. And because they're the ones 100% in control of their ability to get that care, if they don't recognize that they need the care, it really delays them getting the care. So it's a kind of you want everyone to have their autonomy and have the right and control over their body, but when their brain's not working well, it's very hard for them sometimes to make those good decisions. And so that's very stressful for families. And, you know, there needs to be a better way to support them so that they don't end up in jail or homeless before they get the care they need. So some of the ways that stigma affects mental illness is it creates an environment of shame and fear and silence, and it prevents people from getting the help and treatment that they need. Mental health conditions are the leading cause of disability across the United States. Untreated mental health conditions cost the economy $200 billion in lost earnings each year through decreased work performance and productivity. And 8 out of 10 people with a mental health condition report that shame and stigma prevent them from seeking treatment. So we always talk about how words and actions make a huge difference in people in need. There are many tools that I always feel like when I leave that last slide that it sounds so depressing, you know, all of these negative things, but really one thing I would to say is, you know, mental illness is treatable. What we need to do is educate folks, educate companies and the community so that they better understand mental illness. We need to increase the number of people that we have professionals to care for folks. We need people to understand that their mental health is really no different than their physical health, and they need to seek out help when they need it. We need people to understand their healthcare options, because unfortunately, one way that mental illness is discriminated against is in the healthcare industry. Many mental illnesses are not covered by your insurance, or medications are not covered. And we want people to involve their family and friends in their treatment plan, because it's very important to have that support. But there are all of these things: medication, counseling, social services that are available to help support people to get better. And you can get better. So what NAMI Wisconsin does is these are our 3 tenets of what we do. We educate through conferences and webinars. We create resources. We do presentations. We do awareness events. We do support. We host trainings that I'm going to talk about in just a few minutes. We provide technical support to our affiliates and local affiliates throughout the state. We provide one-on-one research referrals. So people call our office or they send us emails asking for referrals or resources. And I don't mean referrals to a specific psychiatrist, just more resource referrals. We advocate. We have a public policy and advocacy committee that meets the first Monday of every evening from 4:30 to 6. We host an action on the square. We collaborate with many other stakeholders, many other organizations like Disability Rights Wisconsin and Mental Health America, and others who are advocating for people with similar missions. And we do listening sessions throughout the state with legislative leaders. And as someone was mentioning, I think Ramsey was talking about knowing Crystal. Crystal used to be our advocacy director, and she is also was a licensed lobbyist. We are in the process of hiring somebody new, but we do lobbying as well with legislators.
Mary Beth, I have a question. Can you hear me?
I'm sorry, I didn't understand you. Were you saying you would come work for me?
No, I have a question.
Okay.
So with the lack of mental health providers, what's being done to combat that?
That is
I know.
Yeah.
I know the Medicaid reimbursement rates are so low that we have to make sure that those get increased, and we have to make sure that people have some continuity of care, so that when these guys aren't getting out of school, it doesn't take 6 months to see somebody. What are we doing to address that?
Gosh, those are awesome questions, and I really appreciate you bringing that up. Well, some of the things that we have done is, especially during COVID, they opened up the ability for and required insurance companies to accept telehealth, which has been very helpful in many parts of the state where we don't have providers. So we've advocated for increasing, and not only increasing, but allowing telehealth to continue past COVID, which I think Medicare and Medicaid is going to do that, but the state legislators, we want them to do that as well. We're advocating for nurse practitioners' ability to expand and be in other parts of the state, because we realize we're not going to train enough psychiatrists as quickly as we can to get them throughout the state. We are so far behind as a state on the number of psychiatrists we need, especially in the northern part of the state. But even in Milwaukee and Madison, we don't have enough psychiatrists to cover the needs that we currently have. One of the things we'd like to see, I know when we talk to legislators, they're constantly talking about giving loan reimbursement to people that go into healthcare services. My problem with that is people have to have the money to take out a loan. They have to have the resources to be able to ask for a loan before they even get a loan. And I'd like the state to find more creative ways of providing so many psychiatrists, social workers, and psychologists the ability to go through school here in Wisconsin at a reduced rate. And so we're advocating for all of those things, but you're right that there are so many areas that need work, and you know, it all requires money, unfortunately. And you're right, we continue to advocate to expand Badger Care because the reimbursement rates are so ridiculous right now for psychiatrists to get reimbursed to see a patient. It doesn't actually benefit them. I mean, I think all disclosure, my husband's a psychiatrist, and I think they get reimbursed something like $20 an hour for a full hour service. And, you know, that's just not justifiable, nor most psychiatrists are not going to do that. So then they have to end up being, you know, willing to work for the state. And then that limits the number of psychiatrists throughout the state as well. So I think it's ridiculous how many of the things that we're trying to do to increase that. It's just a huge barrier, and it takes a lot of work, and we need more advocates to join us in that fight. So thank you very much for those questions. I wish I had a better answer. There's lots of little piecemeal of things that we're working on, but we need more people to advocate and agree that we need to expand several of those things, including increasing Medicaid reimbursement, as well as find better ways to increase the workforce than loan reimbursement, because I don't think that's going to fulfill everything that needs to be done.
I'm sorry, I don't mean to steal your thunder, but what can we do as advocates to help you? Because I know I'm bringing this up as a private citizen, but I sit on some committees. But one of the things we're hosting is a discussion group about healthcare on the 19th. And between, I would like for you to be involved, but you and I can touch base later offline about that.
Yeah, I can think when I get to this on my slide, let's talk about ways, because there is several ways that you guys can participate and be involved. So yeah. Let me get through that, and when I get there, I'll address that. So
I'm sorry.
No. Yeah, it's all good. That's exactly why I'm here, right? That's why you guys are here. So this is our vision of wanting to expand. This is kind of, we did a strategic plan this year. We're hoping to believe that possibility of recovery, and that everyone should receive the mental health services that they deserve, not just those that have money. We want to empower people to be confident self-advocates for themselves. We want to fight for equity and justice. You know, a lot of times we talk about mental health stigma, and we have a bi-monthly newsletter, and I've decided I want to stop calling it stigma, and I want to just call it discrimination, because that's what it is. It's not stigma, it's discrimination, you know. And I think if we use the term discrimination, it's a legal term, whereas stigma seems like a soft social term. And I think it's really beneficial to just to start calling it what it is, even though in these slides you'll still see stigma written, because that's what we've always said. But I want to change it. I'm starting to change my language. So organizationally, this is just about us and our priorities of organizational stability. We want to really support our affiliates. We want to continue to do our public education, And we want to continue our advocacy work, which includes crisis responses, workforce challenges that we were just talking about, early identification, the telehealth and broadband expansion, Medicaid expansion, and the criminal justice diversion, because we think those are the advocacy things that are most concerning to our organization. And just to let you know, the 27 affiliates that are throughout the state, we do trainings for all of these programs. What we do at the state office is we provide a training for volunteers, peers and family members who then go back to their affiliate and provide these support groups and classes. And so at NAMI, everyone that provides, for example, our we call it our Queen program is the family to family program. That was the first program that NAMI did, and it's a class taught and led by family members who have experienced having a loved one with a serious mental illness. And then they go through a training and provide, it's now an 8-week class, to other family members so that they can better understand how to support and love their loved ones who are going through mental health illness. And a kind of a sister or brother class to that is the peer-to-peer class, which is also a 8-week class, and it's led and taught by people who live with a mental illness so that they can help and share what they've learned through their recovery in a class. And the idea is if you provide a family to family class in Madison, Wisconsin, it'll look very much like a family to family class in Tallahassee, Florida. So it's a national program, it's a national class and national training, but we have state trainers that we have here in the state, and we provide the training for the affiliates to go back and provide that. Similarly, for our support groups, there's a family support group, there's a peer support group that we do the trainings on at our office as well. We also do trainings for presentations so that back in the communities, they can go out and do these. 2 of these are the NAMI Ending the Silence are presentations that are done in the high schools, some middle schools. The mental health chat is a program we created that's for 3rd to 5th graders that has someone go in just to start talking to students so they understand that mental health is a part of their overall wellness. And then we just created also one called the Family Experience, which is a presentation given so that people understand the family's perspective. And then NAMI National, we kind of copied that one off on NAMI National's presentation, which is called In Our Own Voice. And it's provided by 2 people who live with a mental illness, and they go out and provide these presentations. And the 2 presentations on the right side of your screen, those are done in community events, at churches, at colleges, and just kind of the goal is to get out there and get the information out about mental illness so that people start talking about it and take action to take care of themselves. We also host the grant for crisis intervention training. This is a training that we have teams throughout the state that provide a training to law enforcement. It's a 40-hour training, and it tries to teach them how to better respond to a mental health crisis and try to find a health response to a crisis instead of a jail response to the crisis. And if ever you know somebody that's in a mental health crisis, it's always best to ask for a CIT trained officer or a mental health officer. Then they'll be alert that that's what they're responding to. And their perspective will be a little bit better on looking at this as a mental health response. We also are in the process of working with many communities that are creating a co-responder model. So that's where you have a social worker that drives along with a law enforcement person and is the first person that interacts with a person in a mental health crisis. Because quite frankly, it's a mental health crisis. It's not a law. It's not a legal issue. And we're hoping one day to kind of decrease this law response to something that's a health crisis. We also in Wisconsin uniquely have a crisis intervention for partners. It's a 2-day training and it's for people. We've done this for Festival Foods had us do a training for them because their grocery store is right across the street from a homeless shelter, and they were having a difficult time responding or knowing how to respond to those situations. We've done it for librarians, we've done it for teachers, we've done it partners are people who are out in the community and interact with people who experience mental health crisis so that they to better understand how to respond to folks that are going through a mental health crisis. And these are our 2021-2022 legislative priorities. And as you see, they're the first one to expand Badger Care, to grow the mental health workforce, to provide access to affordable and community-based treatment services, to strengthen relationships between the general criminal justice system and communities. Our office is this month, it's already May, is going to an event. It's a summit to discuss increasing the number of mental health courts across the state. And we're looking forward to that because those are very successful. There's 3 in the state right now. And we'd like to see more of those created. And then supporting youth mental health initiatives as well. So when you asked what you can do, there's a couple of things that you can do. One of them is we're hosting something called Nami Smarts training. It's online. It's a hands-on advocacy training program that helps people living with a mental illness, family, friends, or advocates to learn how to skillfully advocate for your needs. This is kind of a program where you learn how to make an elevator speech so that you can go talk to your legislators about it. It also includes the best ways to write to your legislators, and it's 3 different sessions. I think there's 5 parts, but we're going to do the first 3 parts of this. And so if anyone's interested, you can go to our website and sign up for that. It's actively on our website right now. And those are the 3 nights. And you don't necessarily have to do all 3 nights, but this is one way you can advocate. Another way you can advocate is through, we have a public policy and advocacy committee that meets, as I told you, on Monday nights, the first Monday of the month from 4:30 to 6. And we welcome anybody that's interested in being a part of that public policy and advocacy committee. We're always looking for people, different voices all over the state so that we are sure that we're getting advocacy from all over the state. And then I always just love to throw this up because I think it's really good information for people in the community to know about. There are 6 peer-run respites across the state. These are respite centers for people that are not feeling well, but do not feel that they need to go to a hospital. They're run by a certified peer specialist, and you can stay there for free up to 7 days and receive the support of those people that work there that are certified peer specialists. They also provide warm line services. So if you just need to talk to somebody and feeling stressed or anxious or not feeling well, you can call and have interaction with them and talk to them. And this is a wonderful thing that is being provided throughout the state. The Iris Place, the first one, is actually run by Nami Fox Valley. The other ones are managed not in a Nami essence, but we work a lot with all of them. And there is one in particular that's just for veterans, which is in Pewaukee. So I'm just listing those there, and I always want people to know about those. And then throughout the state, there are clubhouses and drop-in centers for people living with a mental illness. These are kind of day facilities for people to gather and socialize and get support. There's usually food involved and activities. And we have many of them throughout the state that I always like to share with anyone that's looking for that sort of resource.
Excuse me, Mary Beth, Mary Kay, I'm so sorry. You said there was a warm line. What's that phone number?
Yeah. So a warm line would be, sorry, you're right. That's a word that we use a lot in our own lingo office. So there's a crisis line that I'm going to share with you, which it means you're in a crisis. You feel overwhelmed. You feel like you're going to take some action that may not be good. You may feel suicidal. Those are called what we call crisis lines or hotlines. And warm lines is one where you just feel down, you feel blue, or you feel anxious, and you need somebody to talk to. And so it's just a kind of a warm hug of a line so that you can have somebody to speak to and it's not necessarily that you're in a crisis.
What's that telephone number? I'm sorry. What's the telephone number?
So the telephone numbers are all listed here, and I will be happy to share these with you in the chat line. Hang on. I'll do that after I get done talking. I'll put those in the chat line if that's okay. You can also access those all on our website, and I'm just going to show you real quickly. I just want you guys to know about a couple of things. The normal National Suicide Prevention Lifeline that everybody's been, you know, you'll be at the end of a movie, they show it to you, you'll see it on poster boards, billboards, and whatever. 2 years ago, the federal government signed a bill that number is now going to change starting in July of this year, and that number is now going to be 988. So you can call, which is a whole lot easier to remember than 1-800-273-8255. So starting in July, you can call the number 988, and it will be the National Suicide Prevention Lifeline. So if you know someone that's in a mental health crisis situation, calling 988 is now going to be an easier thing to do than calling that really long number. And it's going to be changing over. The old number will still work forever because they don't want to, that's obviously printed on a lot of things, and they don't want to not have that live. But we're going to start sharing and advertising and talking about 988 quite a bit. So just wanted everybody to know about that. And then Nami runs a hope line that you can text. It's not, you can text that number 741-741 and talk to anybody anytime. More of a warm situation, but the 988 is something that will be a lot in conversation about it in the next couple of years. So the federal government passed a law saying that all of us have to have that, all of the states have to have it. However, as most things the federal government does, they didn't include funding for this, and they're expecting the states to find funding for it. So there will be conversations about how are we, for 2 years it is being funded through ARPA funding, which is the funding that was given to a lot of people from COVID response. But there will be a conversation of either trying to add 10 cents or 20 cents to our cell phone bills, or whether we find funding through our budget, you know, biannual budget that we have in Wisconsin, or how we're going to continue to fund that. And so that will be an ongoing conversation, and it won't just be funding a 988 phone line. It'll also be funding crisis response centers. So one thing we're advocating for and fighting for in this process is to make sure, right now, if you call 911 and you're in a mental health crisis and they send a police officer, and that police officer takes you to a local hospital, and that local hospital says they can't take care of you, those police officers are charged with driving that person to Winnebago Mental Health, no matter where they live. If you lived in Superior, it would be a 3-hour drive in a police car to Winnebago, which is an awful situation to ask anybody that's in a mental health crisis to do. So what we would like to do, and what we're, the funding, a part of the funding in 988 would be having crisis stabilization centers built in all the DHS regions across the state, so that people don't have to go so far from their home, and also that it's treated as a medical situation and not a legal situation. So a part of that funding will have include crisis stabilization centers. There was funding passed for a couple of more to be built in Milwaukee, and we're hoping to have 4 more built soon, so that we don't have to deal with people being in the back of a police car for 3 hours when they're not doing well. And then a lot of this information I'm sharing with you is available. We just republished our resource guide, and you can find that on our website. It has all of the information and way more than you can imagine about mental health resources all throughout the state. It's free. You can download it from a PDF. If you would like a hard copy of it, you just need to call our office and we can mail you one. We have the ability, the one on the website has a little fun flip page that you can go through, but it also has the ability for you to download it. This is our 10th edition, and this one is the best because we've updated it and added many pages and added new information. Also, on our website, we have a link to, as we were just talking about the worm lines, several different specific worm lines that sometimes they have worm lines that are for specific diagnoses, and we list a lot of those. And then we also on our website have our legislative priorities that Crystal made a lovely video about our legislative priorities and why we chose those priorities for mental, for NAMI.
I'm sorry, I'm really good. What is your website for those people that can't see it? What is your website?
I'm going to stop sharing and then I'm going to put it in the chat. Are you able to access the chat?
Some of us can, some of us can't.
Okay.
Depending.
Our website is just namiwisconsin.org. So it's pretty easy, namiwisconsin.org.
Okay, and then what's that number for the warm line?
Yeah, let me pull that up and put in there. And while I'm doing that, does anybody else have any other questions?
Sorry.
No, you're fine.
Good.
Does anyone have any, Denise, do you have any questions? Larry, Mark, do you have any questions?
Yeah, I do.
Okay, go ahead, Denise.
Mary Beth, my name is Denise Horton. I just joined People First Wisconsin a while back, and I have a question for you. I am I have a degree, a bachelor's degree in social, well, Bachelor of Arts degree. I'm a life coach, and I was just trained as a grief educator by David Kessler. And I was wondering, and I don't have a mental health background either professionally or personally, but I would like to be trained in something where I can help someone in that capacity. And I was wondering, what would be the first avenue that I could take?
So, and what would you want to use that training for? Are you talking about like in a job capacity or just as a friend and in a community support?
Not so much as a friend capacity, but maybe not in a work capacity, but to have knowledge, to know, because I'm an information junkie, but I like to use my skills. And I feel like information is power. So if I could be like trained professionally, now whether I use it in a paid job or whatever, that would remain to be seen. But I would like to be there for people and maybe be like a paraprofessional for someone that needed some assistance, but give me some background in it so that I know kind of where to go, kind of what to do, kind of thing.
Mm-hmm. Denise, where do you, which county do you live in?
I live in Rock County in Janesville.
Okay, so I would suggest, we have a really good affiliate in Rock County. It's called Nami Rock County. And on our website, you can find all of our affiliates. I'll put that. We have a neat little map. I would reach out to your local NAMI affiliate. Also, one of the trainings I can think of that might be helpful is something called, and we don't actually do, NAMI doesn't do this training, but there is a training called Mental Health First Aid. And most of your community colleges and in most communities have that mental health first aid training. I don't know what they've done because I know during the pandemic, they didn't host those trainings. I'm assuming they're going to be going back, but it's a good general education on mental illness and how to help and support people. Hence the name Mental Health First Aid, because it's the idea is it's a first aid response to people living with a mental illness. And that one's for anybody. It's a lot of our trainings, we specifically are training people that are either a peer living with a mental illness or a family member that's, you know, learning how to support and help someone living with a mental illness. So our trainings kind of target those two areas. The mental health first aid is a really good one for anybody to take. And then if you get certified in that, that would be a really great benefit to add to your resume if you wanted to find a job and utilize that skill.
So since the mental health first aid is not something that Nami does at the moment, how would I find it? Just Google it?
Yeah, I will. So actually their website is not so great, but let me, I'll pull that up for you.
And also, the 7 for 1 thing, at Mercy Hospital, I don't know, I got to sign at Mercy Hospital, but I tried to follow up with it one time and explain to them that I had a degree in social work, you know, a background in, what, Bachelor of Arts degree, And I was told that I couldn't be a volunteer because you needed to have a.
Denise, I can't hear what you're saying right now. I'm sorry.
Okay. I was told that I couldn't be a volunteer for the 741 hotline because I had to use a tablet as opposed to a computer. So, and at that point, I didn't know where to follow up with it.
Oh,
Yeah.
So, it's just something to keep in mind.
I can answer that since I'm a crisis counselor for crisis text line. Yeah, you do need a laptop just because they don't want anything to go wrong, like your tablet or phone to crash, and then you lose contact with all the texters. So
Okay. Thank you.
yeah. So I did put the mental health first aid in the chat, and I also put 3 of the respite centers with their warm line phone number.
Okay, and I missed that because I wasn't looking at the chat, so.
Okay. Well, I'm happy, you know, if you want, I can send a piece of paper to Nathaniel and then he can share it with you guys if you want.
Okay, thank you. I'd appreciate that.
Okay, that sounds like a good idea.
Denise, I'll send out the recording. And then when you review the recording, Denise, you'll get to see the chat that the links are in. And then you can go with, you know, get online and click on the links if you view the recording, okay?
Yeah, so do you guys have any other questions or concerns or? So tell me what you guys do. Will you guys meet and discuss certain things? Do you guys have an advocacy group that do you have someone that goes to the Capitol and talks to legislators, or what do you guys do?
People First Wisconsin has an executive committee that goes to the Capitol.
Great.
So Cindy and I don't go to our job responsibilities are to like bring in speakers and making sure that our members are inclusion, and making sure that everyone is accepted and they have a voice. That's the main idea. Is we're trying to build up the voice skills, like call up your legislator, call up your just easy. Like I am a national self-advocate for the National Self-Advocate Council for the ARC. We like I get these emails and you can text and like tweet. So I'm working on with some self-advocates on the Living Well grant just to accomplish that stuff right now. So it's a slow process, but I think that once we can get the steps in place, and they'll be able to call up the legislators or call up to get help, because I do think that just calling someone to talk about mental health, you know, where do they go? What aspects? How do they talk? You know, just basic language we're trying to instill here.
Right. That's great. Well, I would consider it, even if you just sent one representative to NAMI Smarts training, I think it would really, it's not a complicated training. It really is led by somebody who used to actually work as the public policy and advocacy director at NAMI National, Sita Deal. And she would be great to, it's a concise training on how to communicate with leaders. And there's different sections. It's one is verbally speaking to them, and one is how to send, you know, succinct emails that really get and grab their attention. So, you know, it would be great if somebody from your organization wanted to join that. And I, again, included that in the chat, but it might be really helpful, or maybe you guys have already done something like that, and this would be repetitive on some sort of training you've already had.
I don't know if Cindy wants to speak, but from my knowledge, we haven't had any trainings like actually go to a NAMI Smart training or any. We haven't really talked about that. We talked about like mental health as a problematic thing, like what is the first steps to get mental health treatment, stuff like that. But I really do think that we have to have a lot of people take trainings so the message is clear, and so people can feel comfortable and be able to understand what mental health is and how they can get the assistance that they need.
Well, that's great. Well, feel free to join us for that training. We'd love to have any of you. It's a good training, whether you're talking about mental health or any other issue that you want to, you know, put forth to a legislator or leader. It's just a really good.
I mean, I like, for instance, I am on National Migraine. I'm involved in the National Migraine Society, and it's like just calling up your legislator, and like just like the National Migraine Society is working on the firefighters who were exposed to all that smoke during 9/11. That's the biggest concern right now. I mean, there's so many problems in the world. So that's why I always go back to, let's see if we can get the self-advocates and make them leaders. And as they become leaders, then the chain will follow. That's how I see it. So.
I totally agree. We need more people, real people, right, to be leaders and legislators instead of people that aren't living the experience that we're all experiencing. But I also think it's really important to advocate for yourself. And I know that we have shown many times telling your story and sharing your story and how something has impacted you, and having those really intimate conversations with leaders can be very important. And even talking to their aides, because sometimes they won't talk to you, but the aides will talk to you, and just getting their ear is really important as well. So I applaud everything you guys are doing. I really appreciate it. And I really appreciate allowing myself to come here and talk to you guys and put a focus on mental health through this pandemic. It's, you know, the silver lining of the pandemic has been people are really talking about mental health a whole lot more in their mental illness. And we've had.
Mary Beth, I will send out the PowerPoint to our members.
Okay.
And if I have any questions, or if like Cindy and I want to debrief, we want to reach out to you again to make because how many people are you looking for the trainings, you know, the smart trainings, or, you know, just like, because I don't want to like announce something and then like a whole bunch of people sign up and then say, oh, we're filled up, and then so I just want to be very careful
Yes.
of, you know, I'm just trying to take the initial steps. That's all.
That's
And
great. That's
yeah,
great.
I'm just being very diligent here because this is mental health. You know, I know what to do, but you know, well, people who don't want to tell their iris consultants why, you know, it's just, you know, I just really think that we can do as much as we can now to make sure that everybody is safe and they have someone who has a voice.
I,
Go ahead, Ramsey.
I'm sorry, I have a
No.
question, Mary Kay. What is your phone number at your office? Do you guys have a phone number?
Our office phone number? Yes.
Yep.
It's 608-268-6000. And I'll include that as well in the chat here. And Sydney, I don't believe there is a limit, but I'm sure there is. So let me confirm with the program director to make sure that there's not a limit, but I wouldn't worry about that right now because you know, it's in a month and we're taking applications right now for the training, and I don't believe there's a limitation, but let me confirm that.
Okay, cool.
Well,
Because I know a lot of people that would want to get on.
Yeah. I bring how plain language is the application. Is it very difficult? Is it, I'm just saying because like with the public policy making class that I just took, Cindy took it, Ramsey have taken it. Some of the questions on that application were very difficult. Like they made me write a lot and stuff like that. How is it like the comprehension of the application is?
The application is, it asks for your name and address. It asks, are you a consumer, a family member, a friend, or someone who identifies with a mental illness? So if you weren't somebody with mental illness, you just say you're a friend, because I think all of us are friends of somebody with a mental illness, right? And then it tells you about the 3 trainings, and then it says register, and it just says, it just asks you to click on the ones that you would like to take.
Okay. Oh, great. So it's a pretty easy process. Yeah.
And if it's something
Okay,
that's too overwhelming, you can just call our office and we can, you know, complete it for you. So if that's, you know, too difficult, then I understand there's all levels of comfort with technology and everybody's ability to have a computer, and your Wi-Fi may not work.
Correct. Yeah, and that's why I brought up that application process. So we can say, hey, if you really want to attend these trainings, or if you want any assistance, please contact Nami.
Yes.
They're willing to help you at a drop of a hat.
Absolutely.
And I don't want to, but we're just trying to make it easy for like everyone. That's all.
No,
Thank
I
you.
completely understand, and I appreciate that indeed. So thank you so much for inviting me, guys. I do have to wrap this up because I have an auditor here.
It's okay. It's okay.
So make sure
It's
that
okay.
we're doing everything we're supposed to be doing right. So thank you so much, and I appreciate the opportunity to share, and I'll send my PowerPoint to you, Nathaniel, okay?
Okay, thank you so much.
Thank you, guys. Have a good day.